I'm from New York.
New York, awesome. Oakland, Tennessee, cool. All right, Karen, hey, how's it going? Yeah, I love connecting with you guys in these live. So it's always feels so one way sometimes on social media and whatnot that I'm talking to you guys, but I never get to see your faces. So I always love doing these. So I am super glad. Oh, California. All right, awesome. So I'm super glad that you guys are spending an hour with me this Sunday. I really think that this is going to be so helpful for you if you've been struggling with impingement or tears or whatever it is that got going on in your hip. My guess is most of you guys right now are kind of, if you clicked on this webinar, you're probably feeling stuck in one of these two places. And this is usually what I see with my clients is you're either are feeling like I just have to live with this pain and I can't do the things I love anymore, or it's just going to have to be a part of my life forever. Or you might be feeling like maybe surgery is the only other option. You've tried all the things and nothing has really worked, and you're kind of feeling like, well, maybe surgery's it, but also not super confident that that's even going to be the right choice for you. And I know that that can feel really hard to, try to pinpoint like what should your next step be. And again, that's what I really want to be able to give to you guys today because the reality is neither of those options that I put on the screen here, they're not very good options, right? They kind of suck. And so you're also in a place where most of my clients are as well when they first start with me. And my goal today is to be able to show you that there actually is another alternative. And I hope that you'll be able to see that there really are some other things that you can do. So if you are struggling with any of these things, I just want to let you know that today this is exactly what we're going to help you solve, and you are definitely in the right place. So if you're somebody who's trying to decide if surgery should even be on the table for you, if it's the next right move, but again, you're not feeling really confident that that's even a viable option for you, you are in the right place. If you've done physical therapy and you just feel like it didn't work, if you are, it might be pain that you're still stuck in. It might be that you just don't feel like you're making progress with your strength or getting back to the higher goals or activities you have, like maybe running, you are in the right place. If you maybe have already had surgery, I see a lot of people who have already done this and they're like, that also didn't even work. Like, what the heck do I do next? This is for you. And then again, just if you've tried everything, the injections, the medicine, the random exercises that ChatGPT told you to try or Instagram told you to try, and it just didn't feel like it worked. I hope that this will give you, I know that this will give you exactly what you need to be able to move forward. So, if you guys don't already know who I am, my name is Dr. Jenna. I am a physical therapist by trade, although these days I spend most of my time doing virtual online coaching. And so I do have an in person clinic here. I'm located in Gainesville, Virginia, which is like just outside of Washington, D.C. I'm maybe like 45 minutes or so away from Washington, D.C. in the Northern Virginia area. And my primary passion in life is to help people who are struggling with impingement and labral tears, who are feeling stuck and like they've tried everything and have kind of lost hope. That's really my goal, is to be able to give people their hope back again. And that's what I spend my days doing these days. When I first started as a physical therapist, my specialty is dance medicine. So I work with a lot of dancers. You can probably tell by the name of my clinic, On Point Wellness. But I don't treat just dancers anymore. In fact, I don't these days really the only injury or issues that I even see are people that have hip problems, specifically impingement, labral tears, dysplasia, hypermobility, stuff like that. So that's primarily what I spend my days doing. And I've been doing this for about 13 years. Probably for the last almost 10, I've been exclusively focused on the hip. So a lot of experience in this. I see a lot of things that maybe the traditional clinician doesn't, because I stare at hips literally all day long. And so, physical therapy is great, but we're all generalists. So they're really great at teaching at helping you treat all the things, but maybe not so great at treating you if you are struggling with these issues, because there is kind of a specific pathway that we can follow to get you unstuck. Um, and just so that you guys know, there's a variety of different ways that I work with people these days. It's not just one-on-one in person anymore. Like I said, I do a lot virtually. I have online programs. I've written a book, different resources. And so lots of ways to be able to help people no matter where you're at in your journey or where you're even located. So the goal of our webinar today is the first thing we're going to do is we're going to talk about what's actually going on in your hip, because I know it is frustrating to feel like you are always guessing what the heck is even happening and what you're feeling and if it's normal. So we're going to talk about that. We're going to talk about why it feels like nothing else has worked, even if you've done physical therapy before, or maybe you've even had surgery, why those things maybe aren't giving you the relief or the outcome that you desire. And then I'm going to spill all my secrets and I'm going to show you the exact framework that I use with all of my clients and in all of my programs to actually help them make real change and progress that they haven't been able to make before. So I'm going to walk you through that, and so that you know and leave today knowing a clear next step of what you can do no matter where you're at in your specific journey. So let's just dive right in. If you guys do have any questions, just pop them down in the chat as we're going through this, because I will go back and answer them at the end. And we'll kind of be able, I'll save some time so that you can ask me any specifics. So let's talk about what's going on in the hip. We're going to do like a little anatomy lesson here. First things first, let's talk about symptoms you might be feeling. So there's a lot of different things that people feel when they have impingement or tears. And the one thing I want to make sure that you know is those symptoms, there's almost always a pattern to them. And so they're never really as random as they might seem. But there's a lot of different symptoms that you might be having. So things like feeling a pinching or a sharp pain, specifically in the area of like the front of the hip or the groin. Those are like two really common areas that we see, that we have complaints. But that's not exclusive. That's not the only place that you might be feeling symptoms. You know, a lot of times we hear about it in the front, but the other places people complain of pain are on like the outside of the hip. Some people have pain on the back side of the hip or in the SI joint. It can really move around to a lot of different places. Often the pinch or the sharp pain will be kind of in the front of the hip or the groin. You might also experience a catching sensation or a like feeling like almost something is clicking or getting stuck in there inside of the joint. That's also a really common thing. There's something we call the C sign, which is basically like if you were to take a C shape with your hand and wrap it around your hip. So like your pain is in the shape of a C around your hip. It's deep. You can't quite pinpoint it. It's not like you can touch it from the outside. That is often a sign of impingement or a tear. Hip flexors are a big area. So again, that's kind of on the front side of the hip, but a lot of times people will complain of feeling like a chronic tightness that just never feels like it will go away. It's like you stretch and you stretch and you stretch, and it's almost like it either doesn't hit where it hurts, or it doesn't make it feel any different. Sometimes it makes it feel even worse. That's really common with this type of issue. And then, as I mentioned, that pain, it often moves around. It's not exclusive to the hip or the front of the hip. It might be in your back. It might be in your SI joint. It might be in your knee. I see this a lot where people are like, you know, I went to the doctor because my knee hurts, but it actually was my hip all along. So lots of other places that you can get referred pain, or compensatory pain. Sometimes the other hip starts flaring up a little bit too, just because you've been compensating a little bit. So that's also really common. Pelvic floor symptoms are also really common. So this might be things like feeling urinary leaking, or you're feeling a lot of pressure or heaviness in your pelvic floor, because your pelvic floor is actually quite connected to your hip. And a lot of those muscles cross over and are the same. And so the symptoms that you'll feel in your hip are also pelvic floor symptoms. And so that's another really common area that you might be experiencing things. So often people will say to me like, oh gosh, I had no idea. Like, I don't even think this is connected. And what I would tell you is there is a very strong chance that there is a correlation between some of these things that you might be feeling. So to kind of give you a little visual of what might be going on here, these are actually some of the hand-drawn, I know my really fancy hand-drawn pictures here. These are straight from my book. So I try to keep things really, really simple and approachable, because I think sometimes anatomy can be really hard to visualize and understand. So I try to keep these really, really simple for you guys. So just the important things that I want you to see what's happening. You have the femoral head, which is the top of the thigh bone. And then you have the acetabulum, which is it's basically the socket that's on your pelvis. And so you'll often hear it referred to as femoral acetabular impingement, and that's what's being referred to. So head of the femur is the ball, acetabulum is the socket. That's where we get femoral acetabular impingement. The labrum is the ring of cartilage that is right between the head of the femur and the labrum. And that's your cushioning, but it also deepens that socket a little bit. It's kind of like it suctions it in there. So it holds the head of the femur really stable and steady in the socket and gives it a lot of stability, which is awesome because it means that our hip joint is a really stable joint, but it also has, it's a ball and socket, so it has a lot of freedom of movement. We can move in a lot of different directions. Now, if you are somebody that has maybe had an image before, these might be terms that you've heard before. So there's something also called pincer impingement and cam impingement. Basically, all that means is there's a little bit of extra bony growth on one of these two areas. So they're in a pincer impingement, there's a little bit of extra bony growth on the socket or that acetabulum. And in a cam impingement, there's a little bit of extra bony growth on the head of the femur. And so in either types of these impingement, we do have a bit of a structural issue going on where that socket, it doesn't, the head of the femur doesn't quite fit in that socket as nice as it normally would. And so when you go to move, you get a little compression between those two bones early in the movement, or maybe where we normally wouldn't have it, and that can create some irritation. Now, yes, impingement can be a structural issue, but the biggest thing that I want to stress to you is very rarely is it just a structural problem. More often than not, it is also a movement problem. And for some people, it's not even a structural problem. For some people, it's just a movement problem. So what happens is how we control the muscles around that joint are so, so important. If the muscles aren't stabilizing well and we're not moving with good patterns, what ends up happening is the head of this femur. Now, this is kind of if I was looking at your hip from a lateral view from the side, the head of my femur will start to drift a little too far forward in the socket. And it's not like it's becoming, going out of the socket or dislocating or anything like that. It's just putting more pressure forward into that socket. What's supposed to happen when we move our hip is the head of the femur. So if the center is, where this little dot is in the middle of the femur here, the head of the femur is supposed to stay in the center of the joint as you move and flex. So in the case of a functional impingement, that just doesn't happen. The way the muscles are coordinating pushes the head of that femur a little too far forward in the socket. It butts up against the front part of the socket, and that is that classic pinch or catch that you will feel. Now, the labrum just so happens to be in between those two bones, providing that cushion. And so what ends up happening is now I'm getting too much pressure forward in that socket. I'm catching on the labrum, and repetitive catching and pressure there is what over time often causes that fraying and the tear that you might end up with. So not everybody has a tear, but if you're getting this functional impingement where there's too much pressure forward, you potentially could end up with one just by not moving well because you're going to get too much stress on the front side of the joint. And again, what I want to stress here is if we can correct these movement issues, aside from the structure, you're going to end up feeling a whole lot better because there's not going to be so much excessive stress and pressure on the front of that socket anymore. So we can get rid of a lot of that pinching through retraining movement. So that's the brief little anatomy lesson. Again, if you have any questions on that, we can kind of come back to it at the end. But I want to talk a little more about, again, why you are probably here. Because again, as I said in the beginning, you've probably tried everything and it hasn't worked. And if that is you, it's not your fault. You sound like 99% of all the clients that I work with. They have already tried all the things and they have not been able to figure out a solution. And that is what I want to give you today. So what I will tell you in my experience, my 13 years of doing this, the biggest reason that people end up feeling so stuck is that traditional physical therapy does a really, really bad job of teaching you how to understand your hip. And if nobody has taught you how to understand your hip, you can't actually target the real problem. You can't actually solve what's going on. So understanding your hip can be anything from knowing what is triggering your pain, what are your patterns behind why you're even struggling, to knowing how to actually calm it down if and when you are in a flare up. Because if you don't know what's triggering it, it's also really hard to figure out what the heck do I even do to calm it down. That might be understand, I often talk about, moving with good movement patterns. And a comment that I get often on my social media is like, what I don't even know what you mean when you say move with good patterns. And so part of understanding your hip is also understanding what is moving with a good movement pattern. What does that even mean? And so again, you can try all the things in the world, but if you can't figure out how to address these problems, then you're not actually, or these things that are going on, you're not actually solving the problem at hand. So what I'll tell you today is your problem isn't a lack of your effort. You've done all the things, but what you haven't had up to this point is a clear strategy of what to do moving forward. And again, this is why people end up getting stuck. They are doing things like implementing strength training, which we know is really important, but you're implementing it on top of not a very good movement pattern. So we're reinforcing the dysfunction instead of the pattern that we want. You might be ignoring what your nervous system input is. So if you are, in a really guarded and tense state and you're under a lot of stress, that isn't going to help. You could do all the exercises in the world, but we're not addressing the root of what's going on. You're probably guessing with a lot of random treatments and exercise. It's like throwing spaghetti at the wall and figuring out what, if anything, will stick. Social media is amazing. We have everything at our fingertips these days. But the problem is that those things aren't always addressed to your specific body and what your specific body needs. And every body is different. And so, yes, there are some really common patterns that we see with impingement, but just finding random hip exercises on TikTok is not going to solve your problem because there's no strategy behind why you're doing it. Maybe it's a great exercise, but knowing when to do that exercise and how to do that exercise is far more important than the exercise itself. And I just want to make quick note about surgery too, because I know that a lot of you in here are probably on the fence about should you or shouldn't you have surgery, or maybe you've already had surgery. So keep in mind, one of the biggest things people will say to me is, but Jenna, if you showed me this cam and this pincer impingement, and so if there's a structure problem, like, don't we need to change the structure or the problem will persist? And my response is, it depends, not always. In fact, what we know is a lot of people who have no symptoms at all still have a structural impingement. They have something that's different in the head of that femur or that acetabulum. Maybe they have a labral tear and they have no idea, they have no symptoms. So we know that this is happening through research. So we can live with these structural things. The question is the structure what's actually creating your pain and your problems and your dysfunction? Surgery will fix your structure. Yes, they can shave down the bone, they can take out that labral tear, shave it down, but it's not changing how you're moving. And so the people who don't do so well with surgery are generally the ones who jump into surgery without understanding what I'm going to show you here in this framework and these next steps. And they expect that the surgery is going to solve the problem. And the reality is the surgery won't solve the problem because it's only one piece of the puzzle. Now, for some people, surgery is often still the right option, but it should be your last resort after you have exhausted all conservative measures first and exhausted the conservative measures in the appropriate way. And so in this case, the framework that I'm going to show you, this is how you know if it's been good conservative care or not. Here's the other thing I will tell you. No matter what, if you are right now out there and you are debating, should I have surgery? What I would tell you is put in the work first, because worst thing that's going to happen is you still have to have surgery on the back end of it, but you've already learned how to move well and you've learned the foundation that you need anyways. So now going into that surgery, you're stronger, you're in a better place. And on the other side of it, you're going to recover easier and faster. And the best case scenario is you put in all the work and you end up not needing the surgery, delaying need for surgery, or whatever else. So the work that you're going to put in before is never wasted, even if surgery is on the table for you. So, moral of the story is what has been missing for most people and why they often are feeling so stuck. If this is you, you're probably just missing a process and how to know and knowing like what do I need to do and when do I need to do it? What should I be focusing on? And having that guidance and that accountability. And again, that's what I'm going to give you here. So here are all of my secrets. Here is the exact framework that I use with every single one of my clients, no matter how you work with me, whether you are walking into my clinic and I'm seeing you in person, or you are working with you virtually, one-on-one, group program, online program. Like this is the framework. This is the same framework I talk about in my book. So I want to make sure you guys really understand how important this is. This framework didn't come out of thin air. This framework came from essentially 13 years of specializing in this and watching how people have been able to succeed when I work with them when they were so stuck with other people. And so it is called the core framework. The C stands for calm, the O stands for optimized movement, the R is rebuilding strength, and the E is elevating performance. Let's talk a little bit more about what each one of those means. So, the other thing I should just mention before I dive too much into this, please know that these phases, they're never exclusive, right? It's not like we are just like so focused in one phase at a time. We do want to make sure that, there's flexibility of sometimes you have to move forward, sometimes you have to move a little bit back. Like you may be adjusting through these phases, but the framework stays the same, the progression stays the same, and then you move around within them depending on what your body needs and when it needs it. So, phase one is calm and understand. And so, the goal of this phase is to figure out how can I reduce the reactivity of my hip. And so, what that means is, when I say reactivity, it's like your hip and your body is reacting to something. Maybe it's pain, maybe it is stress and tension, but essentially your hip is in this really flared up pattern. And we have to figure out how do you get out of that really flared up pattern. For some people, that does mean pain. For others, it's just clicking and snapping and popping. For others, it's feeling a lot of tension, right? There's a lot of different symptoms that might be happening, but we are trying to break you out of the symptoms that you are feeling. And so we do this through number one, having a better understanding of what's going on in your body. So some of what you are doing today is, in going through this webinar, this is part of phase one. It's understanding and breaking down some of the fear around what the heck is impingement? What is a labral tear? What is safe to do? What isn't safe to do? When you're really fearful around movement and what's happening in your body, there's going to be a little bit more reactivity. You're going to be a little more stressed. You're going to be a little more tense. Your nervous system is going to be on high alert and in defense mode. We have to break that down. And we do that first by understanding what's going on in the hip. And then by trying to figure out what are your patterns? What is flaring your hip consistently? And there's always a pattern. Even if it doesn't feel like there is, there's always a pattern. And once we know that, now we can come up with a plan of, okay, what do we do to calm down those triggers? Is it avoiding those triggers? Is it modifying them? Is it a certain exercise based on the pattern that you're experiencing? This is what we have to figure out. One of the biggest mistakes that I see early on is people jump straight into strengthening, but that joint is still so flared up. And so when we jump too fast into strengthening, well, we can't actually build anything. It's too inflamed. It's too defensive. And so the body's going to react back and you're going to get stuck and you're never really going to be able to progress forward because you just get stuck in this cycle of it's flared up. I rest it, wait till the pain goes away. I start to strengthen again. It flares it up again. Now I have to rest again. And we just go and go and go. So learn how to calm it, and the rest becomes so much easier. From there, we can move a bit more into phase two, which is optimized movement. And the goal here is ultimately to reduce the stress in the joint through improving your movement patterns. Now, everyone does move a little differently, of course, everybody is unique. But what I can tell you from 13 years of doing this is there is some very, very common imbalances and movement patterns among people who have labral tears and impingement. And so This is what we're really trying to go after, is those common patterns first. But of course, through an assessment, we're able to figure out, is there something different, that's going on with your body? We have to address the underlying movement patterns. Otherwise, we're still not addressing the underlying problem that was there in the first place. So again, one of the biggest mistakes is people keep moving the same way that created the problem, and then they start strengthening, and now they're just reinforcing all that dysfunctional movement. And it just ends up making things hurt more. What we want to do is flip that. We want to lay the foundation first, understand how do we correct those movement patterns, really ingrain them into your body. Then we can layer the strength on top. And now we've got something to work off of. So we have to lay these foundations first. And as you guessed it, phase 3 is rebuilding strength. So this is where, okay, we've calmed the joint, we've built a solid foundation of movement patterns. I understand what's going on in my body and how to move. Now I need to start loading it, because without load, we don't actually build the strength and the stability that your body needs. Most of the time, if you guys have done physical therapy before, which my guess is most of you probably have, most of you probably, your therapist jumps straight into strengthening. We got to get stronger. We got to stabilize. Like, we got to do all the things, right? Which is awesome. We do have to do all of those things. However, if you didn't lay the foundation, you're going to eventually plateau. You're either going to plateau, it's going to, keep flaring. It's maybe just will feel like you can only get to a certain level, and you take one step forward and 5 steps backwards. So you kind of get stuck in that cycle because you've never laid the foundation. Strength will stick if it's built on good mechanics and progressive overload. Part of this phase is learning how to progressively overload. What does that even mean? We have to make sure that we're gradually increasing your strength in a way that your body feels safe with, so it doesn't cause it to reflare. But ultimately, we have to overload it, because that's what builds resilience in the body. And we have to make sure that your body understands how to do it appropriately. And so I see a lot of people who get stuck at this phase because they maybe have been doing the same. Maybe we'll use a squat as an example. They've been doing a squat with 10 pounds for the past year, but they don't feel any stronger. They still feel really stuck. Well, if you have no pain with that and you've been using 10 pounds for a year, you're not building strength at that point. You're maintaining, but you're not getting stronger. And the joint isn't going to adapt if we're not overloading it. On the other side of the coin, there's people that I work with who are really afraid to add weight in because it always traditionally flared it up. But what if we could just show you and teach you how do you do it safely so that your body doesn't flare and it actually can improve? And you have to do those things, right? We can't avoid overload forever. You just need somebody to guide you through how to overload appropriately. And once we do that, there is a final phase, because we don't want to stop there. We never want to stop at pain relief. We never want to stop at just getting stronger, because your body hasn't really learned how to adapt to the demands of everyday life yet. It hasn't become ingrained into your lifestyle. And that's what phase 4 is all about. It's bringing your hip into the real demands of life so that you can make long-term changes, not just quick fixes. Again, I think traditional physical therapy is great at the quick fix. I am a physical therapist. I don't want to poo-poo on PT. Like, it's obviously awesome. But in school, we're trained on quick fixes a little more than longevity. And so you want to make sure that if you are working with a therapist, first of all, that you have a therapist who is kind of long-term mindset of like, how are you going to take this beyond just getting out of pain and just out of maybe the past 3 months we've worked together or whatever. We want to make sure that you're building resilience for life. And some of that goes in, there's a couple of things that happen in this phase. Some of it is, getting to those higher level things. It's like, okay, I'm stronger, but I'm not running yet. So how do I transition it into running so I can go run that marathon, or hiking so I can go out with my family? Or maybe it's you want to have a baby. And so I don't feel confident that I can like be pregnant and handle the demand of being pregnant. Okay, well, let's pull all of the foundation you've built and apply it into whatever that long-term outcome is that you're looking for. The other piece of this is making sure it's sustainable for life, because you can't just do physical therapy forever. You can't just do rehab exercises forever. So we have to make sure that what you're doing is becoming sustainable and it starts to just be part of your everyday routine, but not in a way that's overwhelming, in a way that it just really seamlessly integrates into your life and maybe your exercise routine or the activities that you like to do. And it's totally possible to get there. You just need somebody to show you how. So right now, all of you in this room are somewhere on this scale. You are somewhere in one of these phases. I kind of added this awareness phase because, like today, what you're doing in just becoming more aware of what's even happening. For a lot of people, I don't even think they realize that this is what's going on for them. So there's this awareness phase of like you finally have just seen the light and had the light bulb moment. So you might be there. You might be in the phase where you're stuck, you can't get it to calm down. You might be in a phase where you can't figure out how to move well. You might be in a phase where you're stuck at strength. You're plateauing. You're not getting any further. You might be stuck at just not being able to get back to the higher level things. Knowing where you are on this spectrum is really important because once you know where you are, then you know where you have to go. So the real question is, do you know where you are? And do you know what your next step should be? So I'd love to hear from you guys, like in the comments, where do you feel like you fall on this spectrum? Like where would you put yourself? Give me a number in the chat. I want to see where people feel like you're falling. And again, that kind of helps me. This is what I do with all my clients. It kind of helps me see where I need to guide you and what your next best step should be. All right, give me some numbers. Where do you guys tell me? I want to hear from you guys. Where do you think you're stuck? Let's see it. Completely stuck in a flare. Can't get past the pain. Yep. Another like phase, kind of somewhere between phase one and phase two. Yeah, and that's why I say too, like these phases aren't always exclusive. There's so much overlap between them. It really is a spectrum. So yeah, I think that's a really common one to kind of be feeling like you're stuck sort of between two of those phases and not knowing, do I move forward? Do I move backwards? Do I need to stay here for a little bit longer? So um, somewhere between 0 and 3. I don't understand enough about my hip and get scared when it constantly flares up. Yep, another 2 and 3. Yeah. I think, guys, this is so common. This loop. It's this cycle. It's this. I start to move. I think I'm doing well, so I'm gonna add a little more movement. I'm gonna do maybe some strengthening or an activity. I'm gonna go play pickleball, whatever it is, right? And it flares up, and then I have to back off, and then I have to rest, and then I rest. Okay, I think it's okay again. I'm going to start to try a little bit more. It's just, it keeps going. It keeps going. And that creates a lot of fear because what happens is your nervous system now feels like it's constantly stuck in this state of, am I going to hurt myself? And when you're stuck in this, I don't know if I'm going to hurt myself. Your body tenses, it guards, it protects. That's its job. It wants to protect you from feeling pain. And there's nothing wrong with that, right? Like, that's a great thing that our body can protect us. But if it goes on for too long, now it becomes dysfunctional. Now it becomes a problem. It becomes something that we can never get past unless you have the strategy to pull yourself out of it. And so much of it is just learning, again, having the awareness of where am I and what should my next steps be. Once you know where you are, it's a little easier to figure out what your next steps should be. So let's talk about this. Let's talk about what should the next step be. Well, obviously, it's going to be to move into the next phase of the spectrum. But how do you do that? Because my guess is at this point, you're probably realizing, as most of you showed me in the chat, you're realizing why you're stuck. Kind of what that framework that we've gone through. You figure out, okay, this is where I'm getting stuck. The problem is knowing that you're stuck and being able to apply it are two really, really different things. And this is where I think that I can help you. And I think this is why people come to me, because this is what I help you do. And there's a few things that you need ultimately to move forward. Whether you do it with me or you do it with somebody else, this is what I want you to understand that you need. You need a clear plan for the phase that you are in. You need guidance on how to adjust in real time as your body changes. Not, oh, I did these exercises and like they didn't feel good, so I didn't do anything else and I don't know where to go. You have to know, how do I adjust in real time? Because things are going to come up and they're going to change, and that's okay. That's totally normal and part of the process. You need somebody who can teach you the concepts around what's going on in your hip and basically give you the tools that allow you to carry forward beyond just needing to be in rehab, whether that's physical therapy or working with a strength coach or whatever it is. You have to know, how do I apply these tools so I can do it for myself? Not in the beginning, right? You're going to need the guidance in the beginning, but you also eventually need to spread your wings and fly and do it yourself. And unless you have somebody that's teaching you how to do that, as soon as you stop working with somebody, whether it's one on one or whatever it is that you're doing, things are going to fall apart. So teaching you and understand and being able to understand what's happening is everything. And without a doubt, the most important thing that you need is to find that hope again. Um, I don't know if, I mentioned that I wrote a book. My book is literally called Hip Impingement to Hope, because what I will tell you is, without a doubt, that is the biggest thing that I see that people lose in this process. They lose their hope. They feel like, I'm going to be stuck like this forever. And understandable to have that mindset. Without a doubt, that's understandable. But also, we need to get you out of that mindset and to see that the possibilities are, they're there, to not have to be stuck forever. And if you don't have somebody that you're working with that's giving you that hope, I would urge you to maybe reevaluate what working with that person really looks like, and is there a better fit for you? No matter what, this is not something you should ever have to guess your way through, because there is stuff that you can do for it, especially if you are debating surgery. That's really something that you don't want to have to guess your way through. You want clear cut answers. And, it's always hard to give yes and no. It's never black and white. There's a lot of gray, but you need somebody that's going to help you sort through that gray. So this is what I've built. This is exactly why I've built what I've built. As I mentioned to you guys, I don't um, see very many clients in person anymore. I still do, but these days my work is spent mostly in the virtual coaching space, because what I realized is I was able to help the people close to me in my community, but there's so many other people out there that were reaching out to me for help and for support, because I can offer something that I just think other people aren't able to offer. And it comes from having that specialization. It comes from a lot of experience, real life experience, working with people just like you. And so the Hip Lab VIP is my group coaching experience, where essentially for 12 weeks, we walk through this process together. We go through these 4 phases, and the whole step, the whole way, you have my support, you have accountability, and most importantly, you have community. It's meant to help you do everything we talked about today: how to understand what's going on in your specific hip, how to know what phase you're in and what your exact next steps should be, how to reduce those flare ups, being stuck in that cycle. How do we get out of that cycle? How do you feel more confident, more in control? How do you finally build strength that translates into everyday life, or helps you actually feel like you're progressing in a way that's helpful versus getting stuck? And deciding what your next step should be and if it should be surgery. For some people, surgery still will be the right option. That's okay. But you want to feel really confident going into that decision. Now, honestly, I could read these stories to you. I could read these testimonials to you. But I'm going to do something a little bit better, because I just wrapped up my last group coaching, and I'm going to let them tell you exactly what they experienced. This is a couple people that were in this group, and I want you to hear straight from them what they were able to achieve going through this program. So hopefully you guys will be able to hear this. All right, I told you guys tech problems today. See? Darn it. Okay. 1 second. Let me see if I can get it. If not, you know what I'm going to do? I'll email it to you after because I really think that this is so, so, so important for you guys to hear, not from me, but from other people. So I might just have to send it to you in a little email recap because I have a feeling that I'm not going to be able to figure it out on the fly. So rather than wasting your time, um, I'm going to email it to you after. So I will tell you, I've got a couple little quotes in here, but Elsie was the one that you were just listening to, and she did so well with this program. She is back basically running, and she started with almost not even being able to walk. And so she said it's probably the best her hip has ever felt in a really long time. She got that confidence back. She can trust it and know what it's going to do, and it's going to do what I want it to do. She mentions in that video that, she used to wake up feeling so uncertain. She didn't know what kind of day it was going to be. Was it going to be a good day? Was it going to be a bad day? Should I go hang out with my friends? Should I not? What should I even expect? And by the end of these 12 weeks, she actually knew exactly what to expect out of her hip. And these days it's pretty much all good. It hasn't been painful for her anymore, which is huge. Um, Isabel was somebody who was living with us for 2 years, and for 2 years was struggling back and forth of having no idea what she needed. She was ignoring it. I would push through. I'm going to just keep doing it, thinking, oh, my hip will be fine, until it wasn't fine. And it wasn't until she had a plan and a real approach of like what to do that she realized she didn't have to panic and change everything. She just needed to know, how do I manage those flare ups to move forward? And she's somebody that's been able to walk much further distances than she could, without a doubt. Like, this is somebody who still is having some discomfort. However, the fear around it, the knowing what to do, all of that is gone because she knows the plan. She knows the structure of what she needs to follow. Jessica, and again, this is what I told you, that without a doubt, the number one goal is, she told me it's given her the hope back, that it's not going to be like this forever. Her pain levels have been so much better. She didn't even think she could get to a point of not being in constant pain every day. And she is. And so this is real stuff that can happen. It just doesn't always feel like it can happen. It doesn't feel possible, but I want you guys to know that it is. So what does group coaching even look like? How does this even solve a problem? Here's how we do it. We do weekly group coaching calls. This is your chance to ask your question. You can, they are live with me, so you can talk to me about your specific situation and get suggestions on what to adjust, change, what your next step should be live on the call. If you can't come to the calls live, that is okay. There's a form that you submit your questions, and then I will still answer your questions, and we put out the recording after, so you can still get your question answered. The other really cool thing about these coaching calls is it's not just your questions, it's everybody's questions. So we all get to come in that room, and you get to hear me coach other people through their problems. And from what I've learned is most of you guys are having really similar problems, but it doesn't feel that way. You feel really alone sometimes. And it's really helpful to realize, oh, wait, maybe I'm not that special. You're having that problem too. That's going on with all of us. And so you end up not only getting help on your question, but you get help on a whole lot of things you didn't even know you need help on. You get the full core framework. So the framework is delivered through, we do it weekly on our calls. We go through stuff live, but then there's also educational modules, which are put into an app for you that you can watch weekly. They're bite-sized, digestible. They're not like crazy long hours or anything. They're bite-sized videos that you can watch to get the knowledge that you need. And then we will go through it all together when we get on those calls. And you're also getting a semi-personalized exercise program for each phase. And the reason I say semi-personalized is because everybody's going to start with the same base program in this group. But as we start going through the weeks, we start to customize it based on your specific needs. So by the end, you do end up with a pretty personalized program, although you'll find that some of you guys are still doing, similar type exercises. You're getting a community. So you're getting people who understand what you are going through. They are going through it alongside you. You get to share the wins, you get to share the challenges. And it's really nice to have people to talk to because nobody else seems to get it sometimes, right? Your friends don't get it, your spouse doesn't get it, your boss doesn't get it, but we get it. The people in this group, we get it. And to have that support, not beyond just my support, but to have the support of the others in the group is a game changer. And then, of course, you get my support if you feel like you're stalling or flaring. And rather than feeling like, gosh, it's 10 o'clock, I got to go down that ChatGPT rabbit hole. Nope, just pop that app open and you can send a message. You can look at the videos. You can get the help that you need when you need it. The goal by the end isn't that you're not going to have any pain. I can never ever guarantee pain relief. And honestly, anybody who does guarantee you pain relief, you should probably run the other way because it depends on so many factors. What I can guarantee you though is by the time you walk away, you will understand your hip better than anybody has ever taught you before. And you will feel confident in your next steps to guide your own recovery instead of feeling like you are just putting out fires left and right every single day. Now, what comes out of that, I will tell you, is usually pain relief. But again, that depends on you. You still have to implement it. I'm going to give you all the tools you need. You have to take it and you have to do it. And that's where the magic happens. So how do you know if it's right for you? If you're kind of on the fence, like, I don't know, this sounds like it could be really good. I'm not totally sure if this is for me. Let me help you. This is absolutely for you if you are done managing your symptoms and you're ready to actually make progress and move forward right now. You want real-time expert guidance. You're done with the DIY stuff. You're done with the ChatGPT rabbit holes, spiraling late at night. Like, you are ready for answers and you're ready for them right now. And you're ready to recover alongside people who actually understand what you're going through. Don't even waste your time. I'll tell you right now, I'll be the first to say, don't waste your time on this if you're somebody who is looking for a plug and play exercise routine. I'm not just going to say, do these exercises. This is the magic trick and you're going to feel better. That's not how it works. We got to work through that framework. So if you want a generic exercise program, this isn't it. You're going to get a custom exercise program, but you're going to have to go through the foundations to get there. It is 12 weeks. So if you are not ready to commit yourself to 12 weeks, don't jump in right now. Maybe it's going to take you a little time to get there to feel like you're ready, but 12, we're going to make that decision. We're making that commitment right now. And I'm going to support you through it for the next 12 weeks. But what I would challenge you to think about is, where do you want to be in the next 12 weeks? Do you want to be stuck right where you are right now, still struggling with the DIY stuff, still struggling to figure out the answers and bouncing from provider to provider? Or do you want to just be in a place where you're actually doing all the things that the people before you that we kind of mentioned, back running or hiking or, whatever it is that you want to be doing. The other thing is, if you are somebody that does need hands-on clinical care, if you're having a lot of acute symptoms, you're going to do better with one-on-one. So this may not be the right program for you. And if you're not sure, this is where we have a little chat to figure out if I really think that this would be the right next step for you. It isn't for everybody, and that's okay. Sometimes this isn't a good replacement for in-person. It just depends on your specific situation. And then most importantly, here's my guarantee. So this is what I promise you. If you show up, I will make sure that this works for you. If you attend the weekly calls, if you follow your program, if you do the educational modules and you walk away and you don't feel more confident and you don't feel capable and you don't feel in control of your hip, I will keep working with you until you do. I will keep providing you with those online resources and the programming and check-ins until you feel like you get there. What I can tell you is, if you put the work in, we are going to do this together and you will get there. But I don't want you to ever worry that you're going to waste your money and you're going to waste your time, because I am committing to you that I'm going to walk alongside you through this. I'm going to make sure that you get the result that you're looking for. So here's the stuff everybody really wants to know. What does it cost? What does it look like? So it's a 12-week program. There are currently 5 spots available. The groups are small on purpose. This is how it stays personalized and how it stays customized. And the next group starts on July 30th, which is Thursday. So we don't have a ton of time, but you are just in time to get started. And the great part is, you don't have to wait. You just get to dive into all of this. What does the investment look like? It is $17.97, or you can do it as 3 monthly payments of $649. So keep it, more manageable, more digestible for you guys. We can break it up. As soon as I receive your payment, you get instant access to all of the materials to get started. So you can start feeling better as soon as today. And then our first group call will be on Thursday. The group calls are Thursdays at 12:30 p.m. Eastern. And again, if you can't come, they are recorded. If you guys are interested in checking this out and you want to apply, just scan this QR code here. I'll keep it up on the screen for a moment. This is where you can apply. It's going to take you to an application. Again, my goal is to make sure that you are still the right fit for this. And so I do just want to know a few things from you first. And if you're approved, then we'll move forward with, I'll give you steps of how to do payment and all of that. So even if you're just on the fence and you want to talk a little bit more about this, still go ahead and fill out that application. This isn't going to force you to pay right now. It's just filling out the application so that I can see where you're at and make sure that you would even be the right fit for this. It's a small group, meaning we have to make sure that the people go into this group are the right group of people. And so it's really important to me to make sure that you're not just saying yes without having without having my confidence that I think I can really help. So I want to know what questions you guys have. I know these are a few of the most common ones. I think I've probably addressed most of these. If you can't make the weekly calls, they're recorded. You can still submit your questions. Will it work if your case is severe or if you need surgery? Yes, absolutely, because on the back end of surgery, you are still going to have to do all this work anyways. And I promise you that if you do this before surgery, you're going to feel so much better going into surgery. Potentially, you put off the need for surgery. Not always. I can't promise that. But I can promise you that you're going to feel 10 times more confident in your decision and your recovery process. And, again, if you are like, I've done PT, it didn't work. Why would this be any different? My response is this is not physical therapy. This is movement coaching. This is walking you through this framework and doing the things that your physical therapist never did with you. This is not getting you out of pain. This is not just giving you random strength exercises. This is showing you how your body works, coaching you through how to move well, how to build strength, and how to make this something that lasts for life. So I want to know what your questions are. I see a few things in here. Love to get back to running. Yes, absolutely. I think running is an awesome goal. And again, we've got people that are running, right? And Karen, same thing with you too. You want to run again. Yeah, we have people at the end of these 12 weeks, there's a return to run protocol or program. I don't always love the word protocol because it's different for everybody, but there's a program we work on. How do we plug this in to get you back to running? And I'll tell you guys, that involves making sure that you do have the right exercises, but more importantly, you have the right movement patterns to be ready for running. And also, what to do should your hips start to get a little cranky on you again. So yeah, absolutely. That's something that we address. What other questions do you guys have? Have you worked with people who are diagnosed with dysplasia? That's a good question. With zero prior hip issues and suggested for PAO surgery? Yes, absolutely. So I didn't mention this particular webinar. I didn't talk too much about dysplasia. For anybody that doesn't know, dysplasia is basically where the socket is a little bit too shallow, so it's a bit more unstable. So yeah, I work with a lot of people that have dysplasia. Often dysplasia symptoms do come on a little bit later in life. It doesn't always happen when you're younger. And so PAO surgery is the more, it is a more serious surgery than an arthroscopy. They do kind of break your pelvis and put it back together. So it's a big surgery. It's a big undertaking. And without a doubt, what you should be doing for that is exhausting conservative care options first to make sure that your symptoms that you are feeling are even in response to the dysplasia itself. Because not always, like there are people that live with dysplasia. It depends on how severe it is. The severity level can vary a lot. I have a lot of people who ultimately do end up needing surgery, but they're able to put off the need for surgery until they're much older, because they have learned how to stabilize that joint and how to move well and are still doing all the things that they want to do, running, yoga, all the big things. Sometimes there's a few more little, I don't even love the word restrictions, but modifications we have to make when we know you have dysplasia. And it's just learning about how to manage around that if you are somebody who wants to try to put off the need for a surgery. And like I've said before, worst case scenario is we still have the need for surgery, but you go into it confidently feeling like I've exhausted those conservative options. I've tried everything and I feel really confident about the decision to move into surgery. PRP. So I would say PRP, mixed reviews. I'd say it's pretty 50-50. and I think, most docs will probably tell you, I don't know what the exact stats that they give you are. I don't take the 50-50 for, I don't know how accurate that is from just my experience. I feel like it's 50-50 with my clients, but um, yeah, I think it's kind of mixed reviews on if that really works or not. No matter what the injection, PRP, cortisone, any of these, the different types of injections that they will do, um, keep in mind it's sort of a band-aid. Just like surgery, it's not teaching you how to move again. So even if you do an injection and it's really successful, we have to make sure that you're still learning how to move with good patterns. Because the moment that that injection eventually wears off, you're going to start, and you've been stressing the joint the whole way through without realizing it, it's going to start hurting again. That's often why surgery, people will be in pain after surgery. They have the surgery, changing the structure, thinking this is going to solve my problem. But what ends up happening is they never change their movement pattern. They repeat the same stress in the joint that they had in the first place, and now they're still in pain a couple months later after surgery. So I think all of those things you end up kind of hitting the same wall if you don't address these other concerns. And again, I'm not against PRP. I'm not against cortisone. I'm not against surgery. I'm just really pro do everything that you can on the movement side of things before you have the medical intervention done, to make sure that you are maybe a little more confident on making that decision of what the next medical intervention should be. So hopefully that makes sense. Um, so if you are somebody that feels like this could be your next step, just so that you kind of know what would happen, you're going to fill out that application. Once you are approved into the process, if we're like, yep, this seems like it's a really good fit, you'll basically, I'm going to give you access right away into the educational content and a base exercise program. So you can start looking everything through. You can head over to the group chat. You can introduce yourself. You can start connecting with other people. And then we'll have our very first call this Thursday at 12:30. What's really cool about this is it means that you get to start right now. You don't have to wait 12 weeks from now. Keep in mind, I don't run these groups often, so they only run every 12 weeks ish, sometimes a little longer than that. So where do you want to be in 12 weeks? Do you want to be the person that's running again, or do you want to be stuck exactly where you've been stuck for the past year, not feeling like you know what to do to move forward? Let's take the jump. Let's start to figure it out together. Let's make sure that you're actually making progress over the next 12 weeks. And I promise, like I said, if you show up and you do the work, I'm going to make sure that you get there. So here's your QR code again, if you guys need it. I'm happy to stay and answer any questions. Feel free. You guys can unmute yourself if you want. I'm going to take this off the screen. So go ahead. If you want to snap a picture, go ahead and grab it now. And I'm going to go ahead and stop sharing my screen. But yeah, feel free if you guys want to unmute yourself, turn on your cameras. If you have any questions, you want to talk through anything, please let me know. I'm happy to chat with you about it. And I do appreciate you guys all coming and spending the afternoon with me. I know you could be doing a lot of other things on a Sunday afternoon. So I always love to be able to connect with you guys. What else do you want to know? What questions do you have? Got a quiet group today. All right, I must have answered all of your questions, which is great. So what I'm going to do, I'm going to send, there will be a replay. I'm going to send the replay out. I'm also going to make sure in the email that you can actually see what people said about the group. So if you are on the fence about if it could be the right next thing for you, really, I want you to listen to what they said because
On the 12th?
oh, sorry about
Oh.
that. Oh, you
And
talking to me?
is that your thingy?
I don't think she's talking to me. Okay. Uh, so yeah, so I want you to hear from them because you can hear it from me, but I think it's far more important to listen to what other people have experienced and the real results that they get. So, oh, Karen, thank you so much. I'm so glad this was really helpful for you. I hope it was helpful for all of you guys. So tell me in the chat, I at least want to know before we head off of here, what was your biggest takeaway from today? What's like the thing you're going to carry forward from here. Because the reality is, yes, you can come and work with me. That's awesome. But my goal is to still be able to help you guys, whether you work with me, closely or not. I still want to give you guys tangible things to help you understand what's going on in your hips so you can confidently move forward. So what's the thing that you are going to walk away from this today? The biggest thing, having hope. Yes. Yes. I love it. Have some hope. If that's the one thing that I can give you, no matter whether it's on Instagram or webinars or emails or whatever it is, if I can give you back hope, I've done my job. So I'm so glad to hear that you're hopefully feeling a little bit more hopeful around things. What else? What are your big takeaways, guys? I've been guessing what's actually causing the pinch, and you answered it. Hope, yay. Yeah, isn't it crazy how like sometimes you've probably, I don't know if you have or not, but like maybe you've seen a doctor, maybe you've seen a physical therapist, like maybe not, but you're like, what the heck is this pinching that I'm feeling? What a difference it makes to actually see some anatomy and understand, like, I know my anatomy drawings weren't the best, but like simple terms of like what the heck is that pinch that's even happening. Even that can break down some of the fear around what's going on in the body and can make such a difference. So yeah, but I love it. Okay. And hope, of course, is that's the big one, right? If you guys, I'm gonna just shameless plug here because you're mentioning it for me. My book is called Hip Impingement to Hope. I wasn't even gonna share this with you guys, but this is the book. If you're like, yeah, that's a really big investment for group coaching, I understand it is a big investment. It's meant to be a big investment because I'm going to commit to you and you're going to commit to me. And so I don't want people that are not willing to make that commitment and investment. And that's why it is a big investment. So if you don't feel like you're quite there yet, but you still want to learn more, this is my book, It's Impingement to Hope. It's $30. You can grab it off Amazon. Or I can put the link in the chat if you're interested, but this is what it's all about. And whether you come into a one-on-one with me or group coaching, like, or it's a book, this is still going to give you the framework. It just means you have to learn how to implement it. So that is also available to you if you guys are interested. You've seen everyone, done PT, done dry knee, done all the things, done all the things. I know, isn't that the story? We've done all the things. Um, so, and I also know that can make this feel a little scary of like, yeah, I'm going to jump into a group coaching thing and I have no idea if it's going to work. Um, Keep in mind, this is really different. This is extremely different from anything people have usually experienced up to this point. If the webinar was different than anything you've ever experienced, just imagine walking through that program together. It is completely different. Is it possible to get to phase 5 and stay there? Yes, absolutely. That's the goal. The goal of that end phase is to make it sustainable. So that comes in with that comes from a variety of ways, whether it be making sure that you know how to self progress, what to do if it flares, right? So all the way back to that very first thing that you learn of how do I calm my hip? Well, guess what? Once you calm it once, you sort of know what to do. So now, even if you're in phase 5 and you start to feel that pain, like trickling back in, there's no spiral anymore. I'm starting to feel a little something. I know my pattern, so that could go the way I don't want it to. So I'm going to go back to what I learned. I'm going to do the things that have worked. And the goal is that it never actually turns into a flare. And if it does flare a little, it's unrealistic to think you'll never have a flare ever again in your life, right? Those things are going to happen, but you confidently know how to approach the flare and you know what to do for it. And that's the important thing. The other thing too is with progressive overload, the goal is that you understand how do you keep progressing versus one step forward, 5 steps back. So yes, it is absolutely possible to get there and stay there and continue to excel and elevate. That's why it's called elevate, because it's the possibilities become endless once you get to that phase. Another takeaway, being more consistent with strengthening and putting in the work by myself. I made it to the point where I feel better with the strengthening. Yes. But I think I stopped before resilience was built. Yes, absolutely. Yeah. I think that's so much of what happens is if you don't know how to keep going with it and implement it into like the running, for instance, that it sounds like you want to be able to do. Resilience takes a whole lot longer than just getting to the strength phase. It takes more than that. And it does take time, right? It's going to take more than 12 weeks. Realistically, it's going to take more than 12 weeks to build true resilience. But over 12 weeks time, we can walk through that process together to show you how to get there. And you're going to start building some real resilience up. But resilience is earned, right? It's never given, it's earned. And so it does take work to get there. You just need somebody that can kind of guide you to that point. And give you that hope again that it's possible. But running is absolutely something that is possible for many of my clients to get back to, and stay there. So that's, yeah, absolutely. I was running pain free, got lazy with the work, and discharged from PT, and my hip flared again. Yeah. Oh, yes. If that isn't the story, and whether it's PT or strength training or whatever, it's like we do stuff, we work on it, and then you kind of stop doing all the things that got you there. And that's kind of the idea with the framework. It's like by the time you get to the end, well, now you know what worked to get you there, and we have to keep doing all the things that worked in a sustainable way that fits into your lifestyle so that you don't slide backwards once you stop. But it's got to become sustainable, because it can't just be I'm in PT for the rest of my life. That's not going to serve you well. PT hasn't done their job if you feel like you have to be in PT forever. That's not the point. The point is to make you independent and confident. And so we have to give you the tools to be able to do that, with or without, even with group coaching, with or without me. I want you to feel confident long after you're done with me. But things running, again, it's like, I'll give an example too, like running is a single leg activity. Okay. You got to be able to you got to be strong, but I also have to have really good patterns and strength on one leg. And I have to be able to do it under impact. And I have to be able to do it with a lot of repetition and over and over and over again. And if I haven't built my strength and my resilience up to mimic that single leg impact, repetition, high volume, running is not going to feel so good. So we have to make sure that that strength is quite targeted to the goal that you're actually trying to get to. And running is just one example, right? There's a whole bunch of different things you might be trying to get to. The goal is, can we make it unique and specific to you so that it actually becomes applicable for life? So hopefully that makes sense. You guys have good questions, though, that's for sure. Anything else before I wrap it up here? Like I said, I'll send everything over to you in an email. If you have any questions, if you want to fill out that application process, like I said, the worst case scenario is you fill out the application and you decide, it's not a good fit for you. That's okay. There is no commitment in just filling out the application. It's a good way for us to start a conversation and figure out if it's even something that I think would be good for your situation. It's important to me to have the right people in this program. And I want it to be the right step, because I know you've tried everything, and I don't want to be just another thing you've tried. I want it to be the thing that sticks. So go ahead and fill that out. I will send you email recaps. And if you have any questions along the way, go ahead and you can just send me an email back. Do you follow up after the application with additional context? Yeah, absolutely. Yeah. So once you fill out the application, depending on your situation, sometimes we hop on a call. Sometimes we need to hop on a 15-minute call and just talk it out in person or virtually. Sometimes it's a simple question I can answer through email, but however it is, I want to make sure you feel confident in that next step. So there's definitely follow up after that as well. So, but yeah, just let me know what questions, that come up for you after you think it over. And I'm happy to help you however I can. But thank you guys all so much for joining me today. This was so much fun. I hope you learned a lot, and I look forward to hearing from you and seeing some of you again really, really soon. Have a good day, everybody.